Part 1. Understanding ADHD. Have you ever found yourself thinking that you might have ADHD, attention deficit hyperactivity disorder? It's quite common for this doubt to cross your mind, but in reality, many people may confuse the symptoms of this disorder with simple everyday distractions or restlessness. That's where the following question arises. How can you recognize the true signs of ADHD? We will reveal 4 common mistakes made by those who think they have this attention deficit, but actually don't. Follow along. Who hasn't searched for symptoms related to health on Google? Although the search tool is efficient for many subjects, it cannot diagnose diseases or psychological disorders. Don't forget to subscribe to the channel and leave a like on the video. Thank you. Let's continue. Based on this situation, it is known that many people still believe that any sign of inattention could mean a case of ADHD, but that's not quite true. If you have ever wondered if you have this disorder, remember to watch out for 4 common mistakes made by those who think they have this deficit but actually don't. 1. Diagnosing based solely on symptoms such as lack of focus and forgetfulness *. Symptoms such as lack of focus and forgetfulness are common and can result from various factors, including stress, fatigue, or momentary distraction. Therefore, diagnosing based solely on these symptoms can be misleading. 2. Failure to evaluate how the symptoms were in childhood *. People with ADHD exhibit symptoms from a very early age. It is crucial to check if the signs were present before the age of 12, as ADHD typically manifests in childhood. Ignoring this fact can lead to incorrect diagnoses. 3. Friends, family, and the internet suggesting that certain symptoms are characteristic of ADHD *. Self-diagnosis based on suggestions from friends, family, and the internet can be dangerous. Although well-intentioned, these suggestions do not replace the evaluation of a qualified healthcare professional. It is always wise to seek a medical opinion. 4. There are other medical and clinical conditions that can have similar symptoms *. Sleep disorders, thyroid problems, depression, and anxiety are some of the conditions that can manifest with symptoms similar to ADHD. This is a reminder that an accurate and complete diagnosis is crucial. You can't diagnose ADHD on your own. You need the help of a professional to observe the details of your behavior and make a diagnosis. The psychologist highlighted the main signs that may indicate this disorder. The characteristic symptoms of ADHD include inattention, manifested by difficulty in maintaining focus and concentration on tasks, hyperactivity, evidenced by constant restlessness, and impulsivity, marked by a tendency to act without considering the consequences. Let's clarify some points about ADHD that differentiate it from any other common sign of inattention. For example, manifestation in childhood * ADHD usually manifests in childhood. It is important to check if the symptoms were present before the age of 12. Consistency of symptoms * ADHD symptoms are consistent in different environments: school, home, work. Significant impact * the symptoms are significant enough to cause impacts on academic performance, professional life, or social relationships. Comorbidities * other disorders may have overlapping symptoms. For example, anxiety can cause distraction, but it is usually associated with specific worries and fears, while distraction in ADHD is more widespread. It is common for ADHD to coexist with other disorders, such as anxiety or depression, making the diagnosis challenging. To diagnose ADHD, it is essential that the process be conducted by doctors and psychologists, who are the qualified professionals for this task. The first step in identifying the disorder is to gather a complete patient history. This includes detailed information about development, school history, behaviors, and symptoms presented over time. In addition to medical history, standardized interviews and questionnaires are used as assessment tools. These instruments are applied to both the individual and family members or teachers, providing a broader view of the patient's behavior in different contexts. Direct observation of behavior is also a crucial part of the diagnosis. Professionals evaluate how the individual behaves in various situations, which helps identify patterns and better understand the reported symptoms. Dealing with ADHD and prevention. Finally, it is essential to rule out other medical or psychological conditions that may mimic the symptoms of ADHD. This ensures that the diagnosis is accurate and that appropriate treatment can be initiated. Preventing ADHD. Neuroscience still cannot say for certain how ADHD can be prevented. What is known today are ways to help reduce the risk of your child developing the disorder. Here are some tips. During pregnancy, avoid substances that may harm fetal development. Do not drink alcohol. Avoid cigarettes and other drugs. Also, avoid exposure to environmental toxins. Protect your child. Protect your child from exposure to pollutants and toxins, including cigarette smoke, agricultural or industrial chemicals, and lead. Part 2. How to deal with ADHD. Knowing how to deal with the symptoms is one of the most challenging parts of the ADHD treatment process. Some measures can facilitate coexistence, both for the child and the family. Here are the tips you should apply to your child with ADHD. 1. Establish limits and rules. Having clear rules helps structure behavior. 2. Be patient and affectionate. Love and patience are crucial. Praise and encourage your child whenever possible. 3. Praise and incentive. Compliment your child. Encourage them and congratulate them whenever they accomplish a task. When necessary to reprimand them, be careful about how you do it. Excessive criticism harms the child's self-esteem. 4. Spend quality time. Try to spend more time with your child. Showing presence and interest makes a big difference. 5. Boost self-esteem. Look for ways to boost your child's self-esteem and implement discipline in their routine. 6. Teach organization. Teach your child how to acquire appropriate organizational skills, such as a daily activity calendar. 7. Effective communication. Be clear and concise. Avoid using overly complex words when communicating with your child. Try to use simpler words and short sentences. 8. Eye contact. When talking to your child, stand in front of them, make eye contact, and speak calmly until you are sure they understood you. 9. Avoid embarrassment. Never expose the child or create embarrassing situations for them. 10. Use creativity and motivational techniques. Try to use creativity and motivational and reward techniques with them. 11. Don't yell. Avoid yelling. Use no less and instead engage in dialogues that encourage them to think and reflect. 12. Become an expert. Become an expert in ADHD, and you will certainly optimize your child's treatment. Dealing with ADHD is a challenge, but with knowledge, support, and the right strategies, we can make a big difference. Never forget to seek help from healthcare professionals for precise guidance, and never underestimate the power of love, patience, and understanding in the life of someone with ADHD.